Hi guys, Dr. Brockenshire, and this is our follow-up, like I promised, from the weekend lecture we just had on what I call the modern patient paradox. So we spent some time together, live and in person, and hopefully your brains have healed at this point. We did cover quite a bit of information, but my main goal was to get everybody thinking about what went wrong in the last few years and what happened to people. So we created our battle plan, and when we review this, one of the things we spent a lot of time on was talking about these polysystemic challenges. Obviously, nutrition is a key player. It's always going to be a key player. And before we can get to nutrition, though, we had to talk about diet and lifestyle. And so food makes up roughly 80% of the healing paradigm. But you have to make sure it's real food, and so that presents a challenge for a lot of people. But understand that the best diet that we decided on, the diet that everybody can use, is any diet that's not American. So whatever works for your patient is the one that's going to be successful as long as they stick to it. Then from the lifestyle point of view, we talked about feeling safe, releasing fear, not being so paranoid all the time, and how to use nutrition to get people to that point. But the one area that seemed to get a lot of attention and a lot of funny looks was when we talked about cloaked pathogens, particularly the Lyme matrix. So this again is the flow chart that I use in my practice. We've had a lot of success with a variety of different types of bugs. And so what I've done over the last 10 years is kind of map them out for you. So if you follow this, you can track down these critters and take a better approach at helping the immune system eradicate them, or just bury them somewhere else so they're not causing so much damage. And one of the areas that really showed up when we were working on people was the spleen. So we spent a lot of time talking about the spleen. And one of the things we learned was that electromagnetic fields can distort the spleen and challenge the spleen. But all of those things aside, if we could just get these sickest of sick patients to eat more phytochemicals. We were born with the plants. We need to eat the plants. That's what they're there for. Plants are our food. Plants are medicine. The research is clear. The more phytonutrients and phytochemicals you have in your diet, the stronger and more vital you can become. It's as simple as that. The rest of the day we talked about, again, what happened. And when we look at all the things that we can track and map as related to metabolic syndrome, it gives you a really good grip on where you can take your practice. So, for example, we talked about being able to measure organ fat, visceral adiposity. So there's scales and devices that can measure visceral fat. And today that's one of the key markers of overall health and inflammation. So if you're not measuring visceral fat and you're doing any kind of weight loss or body composition program in your office, just go get a scale that measures visceral fat. The ideal ranges again, we'd like to see people at 5 pounds or less visceral fat. If they're over 10 pounds visceral fat, you can pretty much assume they're on their way to metabolic syndrome. And all of these factors are relatively modifiable. So this is a powerful chart. When you go over this with your patients, you can show them just how much control they actually have. And from a cost-benefit point of view, many of these things don't cost money. They just require discipline. And I know discipline's very expensive. So when we looked at that and then we overlaid the new metabolic complex, I think you can understand why pretty much every American adult needs metabolic complex on a regular basis. I'm dosing it at 2 twice a day for most people. The easiest way to see if your patients need something like metabolic complex is just to remember if your BMI is OMG, you should probably be looking at some form of intervention. So if your BMI is over 30, you need to look at something like metabolic complex while you shift the diet and lifestyle. And we went over all the research and literature and talked about the uniqueness of some of these plants. But Metabol is a home run for pretty much anybody wrestling with insulin resistance. The other key we discussed was how when you make a change and when you help people make changes, it can be exhausting. So change is exhausting. The change is going to happen. So to get the energy you need to make that change, we have to support the mitochondria. And so this is my botanical cheat sheet for supporting the mitochondria. And we spent a lot of time talking about Schizandra and Rhodiola as a tag team. Thank goodness we have them in a tablet form as a tag team. And we talked about heart sound recordings. So when you see the heart on a heart sound recording and you see dysfunction, don't forget that the hawthorn leaves can often help the mitochondria of the heart work more efficiently. And then we talked about astragalus as a cardiac tonic. So play around with that. If you're not using heart sound in the practice, have somebody come in and do it for you. It's an indispensable tool. Now, when we talked about EMF, I really wanted to get down and dirty with it, but I didn't want to blow up everybody's head with chemistry. So again, we made a cheat sheet. So these are the botanical tools that you can use on a daily basis to help your body manage, recover, and adapt from EMF exposure. Now, if you want to read or watch a lot more information on this, just go to Mercola.com and search EMF toxicity. But I would say at this point, when you look at this list, this is kind of what we all need on a daily basis. So most people can get by with Rhodiola, Schizandra, and Vitanox as long as their magnesium levels are adequate. If that's not enough, then we would throw in Nevaton Forte and Turmeric Forte. So if somebody was working at a Google server farm, I would probably make sure they have everything. I'd get them on magnesium, Rhodiola Schizandra at 2 twice a day, Nevaton Forte at 2 twice a day, and Turmeric Forte at 2 twice a day. If you do all of that and they still have stress support, the problem's probably not EMF, the problem's between their ears. Okay? That took us into some neuro. So we got into some cool muscle testing, and in your notes you can text the word muscle test to that phone number, and we'll get you some more video on how we do muscle testing for opening the case. And I showed you what leaky brain looked like and how to test for it. And the main test we use for leaky brain is just a modified Romberg's test. So you can look up what that is, and we also do that in the muscle test video. But the beautiful thing about people with leaky brain is you can modify it. So once again, diet and lifestyle. Work the gut, work the gut, work the gut. Not everybody needs a probiotic. Some people need to avoid probiotics. Maybe they need to do more bacterial work as far as changing the bacteria in their gut, and you can do that with things like gut flora complex. The other thing that gets lost in people with leaky brain is they need fiber. A lot of people don't get enough good fiber, so the bifidobacteria that's supposed to be in their body can't eat. So no fiber, no good bugs. So make sure you throw in some vegetables in there. It's just old school medicine. Eat your vegetables. That's how we deal with leaky brain. If you're not sure you have leaky brain, we showed you this slide. So the cool thing about this is most people see that this image is moving. If it's moving, it means your brain's a little tired or a little bit inflamed. So the exercise then is to try and make it stop moving. If you weren't able to make it stop moving, chances are your brain's fatigued, in which case we talked about adding in the main food for the brain, which are omega-3s, and a little bit of magnesium, and you can't go wrong with some turmeric. If that's still not helping, or if this is giving you a headache, then you want to find a functional neurologist and have them do an assessment on you and make sure everything's okay up there. But don't freak out if it's moving too fast. Just try to make it stop. So we listed a bunch of tools we can do for essential brain dysfunction. We got into Parkinson's, dementia, Alzheimer's, etc. Again, why are people getting weird? We gave you some real fundamental lists here that can be applied across all platforms and all supplement manufacturers. And this started to take us into the endocannabinoid system. So when we talked about Alzheimer's specifically, I was able to give you this list, which comes from a study out of UCLA where they did an exhaustive literature review and basically came up with these are the heavy hitters for helping with Alzheimer's. But the one plant that comes up every time we talk about Alzheimer's and dementia is turmeric. So at this point, everybody needs turmeric. I can't think of anybody that wouldn't in general. But again, that leads us into a whole host of other tools, particularly the immune system of the brain. So we spent time on the glymphatics, and we reinforced the idea that manual therapy like craniosacral work, like chiropractic, like massage, is pretty important for helping the brain clean itself. And the other component to that was sleep. So one of the best things you can do for your patients with memory issues is improve their sleep patterns. And if they're flunking that modified Romberg's test, this is your cheat sheet to try and correct that for them. 9 times out of 10, it's either a stress-related issue, so we lean on something like Neviton Forte. If it's a nutritional issue, it's probably magnesium or antioxidants. And if it's a true brain issue, then Vitanox or Turmeric Forte tends to lock the system down. In some cases, if you're not having much luck with this, it could be a methylation imbalance. In those cases, I would try some form of B vitamin complex to stabilize them. The other thing we found out is most of us have glyphosate in our body. And before we spent an hour scaring everybody about where it is, what it's doing, and how it screws us up, it's best to be able to spot it in people. And so if you think about it, almost every one of your new patients coming in could be suffering from glyphosate toxicity when you look at it this way. People that when they try to relax, when they try to go to sleep, anxiety kicks up or their irrational fears are taking over. Anybody with leaky brain, leaky lung, leaky skin, leaky gut, all of these could be related to glyphosate, which is the active ingredient in Roundup. So I made a list of things you can do about it. Obviously, with all toxins, avoidance is the key, but good luck with that. So as you're trying to limit your exposure to glyphosate, don't forget to support and feed all the systems that get depleted. That would be the gut. That would be the liver. Don't forget to support all of the underlying minerals that get depleted. Zinc, selenium, magnesium. You're going to need to support glutathione synthesis. You're also going to want to take a look at the kidneys and bone. So find ways to evaluate the kidney function because a lot of times you'll see kidney imbalances in a glyphosate toxicity. One of the home runs we've got from Mediherb is their rhodiola. So we have rhodiola in the Schizandra blend, we have rhodiola in the ginseng blend. If you're going to work and live in today's modern environment, you're going to need rhodiola in your life. And this is why. Rhodiola is a brain adaptogen. It has been classified as an antidepressant, but it works primarily upstream in the HPA, particularly on the pituitary. And if it's not good rhodiola, it's not going to work. So again, once again, thank goodness for Mediherb. If we were to make a list of why people are getting dumber, we would understand that nutrition is at the top of the list. Most people have a nutritional issue somewhere. We know EMF is a significant stressor on people. We talked a bit about heavy metals. In my book, cadmium and copper are 2 heavy metals that affect rational brain function. So that's worth checking out via a hair analysis or a provoked urine challenge. We know that stress is a big player. So we talked about rhodiola and Schizandra, Neviton Forte. We didn't get too much into medications, time permitting, but understand that most medications that are properly prescribed today do create nutritional deficiencies, and a lot of them can affect brain function. Case in point are the statin drugs. The scariest side effect of a statin drug besides heart failure is dementia. So let your patients know if they're taking a statin, they're staring at dementia because cholesterol is used to prevent dementia. So that might explain why a lot of people are getting a little weird. Chemical exposure like glyphosate and other pesticides, but don't forget we talked about the xenoestrogens, so you've got to support phase 1, phase 2 detox. And for the love of God, get people pooping. I mean, that's the first question we ask. Do you poop every day? The second question is, do you sleep? If you just ask those 2 questions, you can build a whole nutritional practice. Some of the key nutrients that go along with the brain as far as what's missing, well, we kept coming back to magnesium. So you've got to start correcting magnesium deficiencies, coaching people on how to get magnesium in their diet, which is almost impossible, and figuring out what types of magnesium to use. For example, the Easy Mag on a daily basis can be incorporated. And the nice thing about Easy Mag is it also satisfies some of those phytonutrient requirements that we came up with. Recently, there was a study showing that vitamin D is actually dangerous. And of course, that's insane. So again, who's ruling the roost here? The idiots are in charge. Everybody knows that you never dose vitamin D without vitamin K. So make sure you're doing that. That segued down into some other things that are popping up in our patient base, and I see this weekly. Non-alcoholic fatty liver disease. These are all the reasons that this is happening, and at this point in the seminar, you've already figured out how to fix these. Deal with blood sugar, deal with stress, change the diet. That's how you correct NAFLD. At the end of the day, we talked about concussion. So I gave you a cheat sheet on what to look for. One of the ahas for people was to check out sulfate levels. So I gave you some symptoms to look for there. Basically, if somebody were to take Spanish black radish or garlic and feel horrible after, they have a sulfate issue. So check that out in your patients. A lot of people are walking around with post-concussion syndrome and they don't know it. So these are the symptoms. If you have patients complaining of these issues and they can't remember when they started, that will be a hallmark of a concussion. So I would suggest that you take this page from your notes and just make it a handout and say to the patient, hey, why don't you highlight what's going on? And from there you can correct it, and like we demonstrated, the left brain, right brain test and the modified Romberg's will take you pretty far into this matrix. We closed with the endocannabinoid system because we're actually allowed to talk about that now. So remember, this is your relax, eat, sleep, forget, and protect system. And who doesn't want more of that? So if you've been a good healthcare practitioner over the last 20 or 30 years, you understand the autonomic nervous system, you understand the endocrine system, and you hopefully have a good grip on the immune system. The endocannabinoid system is a relatively new kid on the block, and this is the system that ties all other systems together, which is why hemp oil complex was made. This is not a CBD product. This is not a marijuana product. This is hemp oil. So Standard Process has put together hemp oil with calamari, so we have a full spread of omega-3s and 6s, and they added TrueBroc as a broccoli sprout extract for all of its wonderful benefits. So pretty much anybody who's having a hard time settling their brain or staying focused could do well on hemp oil complex. Anybody that can't sleep, this is one of those tools that can make a big difference, and typically we're dosing it at 2 twice a day. Sometimes we need a CBD product, so I talked about a CBD product that I've had made and working with a farm in Colorado. Obviously, Colorado is kind of the ground zero for working with hemp and marijuana. And so what I was able to do is get organic, wild-crafted hemp, have the lab process it with a supercritical CO2 extract format, and we get a really clean hemp oil. Basically, it has almost no flavor, and it's able to be standardized to CBD. So we know that there are a lot more phytocannabinoids than just CBD, but it's nice to be able to know just how much CBD per milliliter we're using, because CBD is our target phytonutrient. And looking at the market and trying to get this from my office, I noticed that there was a wide array of different types of CBD products and hemp oil products. And some of the ones I found from smaller producers were pretty good, but they were horribly expensive. In fact, one of the ones out of Colorado I was looking at had this one at about $350 a month, which is insane. So by working directly with the farmer, no middlemen, just Dr. B and the farmer, We've been able to get the price down to $150 per bottle for the patient. And technically it's in a 60 milliliter container, not 30. This is a pre-production label, so it's got 30 on it, but it's a 60 milliliter bottle for $150. So you're getting 1,800 milligrams of supercritical CO2 extracted hemp oil. The nice thing about this is it's really easy to dose because it's in MCT fractionated oil. So you can dose from a drop to a teaspoon. It depends on what you're trying to do. But if you want to know more about that, drop me a note and I can get you some literature and more information on how to use this stuff in your practice. One thing we didn't spend a ton of time on was practical applications. And at the heart of all good clinical work is clinical expertise. What the media is pushing us to do is stay only in research. So they say, oh, everything should be based over here. But if you've been in practice a few years, you know that clinical expertise starts to trump the research. So use this model as a way to help understand what's happening to your patients. Particularly, what are those patients presenting with? Most patients today don't come with a manual or a textbook. They don't fit into an algorithm. So you have to be very creative in managing the modern patient paradox. And at the end of the day, if we don't teach people about what we do, then what we do isn't going to last. If you work with younger doctors or you have interns or associates, make sure they get this information or at least this video. Hopefully we can plant a bug, plant a seed, and kind of drive some creativity in the natural health arena. So until our next session, I will chat with you soon, and don't forget to drop me an email if you want to know what's going on or what's coming up.